Right, welcome everybody. Thank you for joining. As Gemma said, my name is Sue and I'm the owner of Wellbeing Clinic in Essex, and we've done this series of talks in partnership with Kingswood Group around all things supporting health and wellbeing in the workplace. And this is the last of those, and this is around men's health, which is quite pertinent given that November is Men's Health Month. So we have our private medical clinic in Colchester, and we also work all over Essex on both individual health and also corporate health. So that's just a bit about us. So what we're talking about today and what we want to cover in this session, if you can go over to the intro slide, yeah, great. We're going to do a bit of an introduction on why men's health is important. We're going to look at some UK statistics. So often medically we see a lot of kind of global statistics for things and not necessarily solely focused on just UK or just on one particular gender. So it's quite nice to kind of isolate those to see what's going on. We're going to talk about a couple of types of prostate cancer and testicular cancer, which are quite prevalent in men, more so prostate cancer than testicular cancer, as you'll find out as we go through. But we're going to talk about noticing signs and symptoms of those and what you can do. We're going to talk about heart disease, which is actually the biggest killer of men in the UK. And we're going to talk about the andropause, which is quite important and is getting a lot more light currently off the back of all the menopause talk, really, which is about how male change in hormones affects them in kind of middle life and the impact that that can have on your both personal lives and work lives. And then we're also going to talk about stress, because stress and mental health is really important as well, particularly for for all genders really, but particularly men, as suicide is still the biggest killer of men under 45. It's really important that we acknowledge the impact of stress and how we can manage our stress so that it doesn't escalate to become anxiety or depression, because then it becomes much harder to remove symptoms and improve from that. So we're covering quite a lot, so we'll kind of push on really, but do feel free to interject with any questions, but there will be an opportunity at the end to ask questions as well. So we're going to start by looking at some of those statistics. So here are some statistics that I pulled together. So 1 in 8 men have got a diagnosed mental health condition. So the reality is that it's going to be a lot higher than that, more like 1 in 4. But to actually have gone through the process of getting that diagnosed by a doctor means that the statistic is not as high, but it is more prevalent than that, certainly. On average, men see a GP half as much as women do, which I still find quite a scary statistic, really. I think there's a few factors culturally that play into that. Often men think that symptoms are normal, or they'll have a kind of reluctance to make a fuss or a reluctance to make time for medical appointments. Or they'll think that all their friends suffer with the same thing and it's not a problem. These are all kind of reasons that I've heard historically before. But it's obviously really important, regardless of gender, for anyone that feels that something isn't right to get checked out by a healthcare professional. And although that's not always as easy to do in the current climate as it used to be, there are services like ours that can kind of fill in when the NHS is hard for you to access. Prostate cancer, which we're going to talk about shortly, is the most common cancer in men, with more than 30,000 men diagnosed each year in the UK. 1 man every 45 minutes dies of prostate cancer in the UK, so it is huge in terms of the impact that has on men and their lives and their families. Much too high for my liking, and we're going to talk about the preventative screening that you can do as men in the absence of the NHS guidelines, which are far too late in my opinion in terms of screening men and helping men with prostate cancer. And interestingly, some statistics are that generally more than 4 in 10 cancers are preventable. So that's kind of massive in terms of the impact that we could reduce by supporting more people earlier with their health. And some more kind of general statistics around obesity, because I think we all kind of think of, smoking is really bad for your health, alcohol is really bad for your health, and we forget that actually we are quite a fat society generally, and even being overweight, but particularly being obese, is a huge risk factor for cancers in particular. And it's the second leading cause of cancer after smoking. So it's really just a reminder about why it's so important to look after our physical health from a medical standpoint as well. And linking to that, 1 in 6 men in the UK will die from heart disease, which is huge. There's 110,000 heart attacks each year in the UK, which a vast majority of those could be prevented or at least pre-screened so that they don't get to that point. So it just shows you that we've got a long way to go in terms of reducing some of these health inequalities and health accessibility to services. So one of the reasons why that's so important as well, particularly for men, is that, as I said at the beginning, they will be much less likely to access health services, but also much more less likely to understand what the signs and symptoms are of certain conditions. So that's really what I want to get across in this talk as kind of the main things for you to notice. And we're going to start with prostate cancer to do that. So, prostate cancer is an incredibly common cancer in men. Most men will die with prostate cancer, even if they don't die from prostate cancer. That's how prevalent it is. There's a diagram on the right-hand side there, a bit kind of cartoon of the kind of male anatomy, but you'll see that the prostate sits very close to the urethra, which are the tubes that run down from the kidneys. And it's also inconveniently positioned very close to your hip bones and your pelvic bones, which is why one of the risk factors for prostate cancer, if it's not caught early, is that it spreads into your bones. And unfortunately, once cancer's into your bones, there's not much coming back from it. So it quite nicely kind of depicts kind of what's going on there in terms of proximity perspective. So you can feel the prostate gland from a rectal examination, and historically that has deterred some men from getting their prostate checked to see if it's enlarged. But however, these days we tend to focus much more on what's called prostate-specific antigen, or PSA, blood test. There is still the need some of the time, although you can object to having a rectal examination, but even from PSA numbers alone, you can diagnose prostate cancer, and then we would do a scan to confirm that kind of clinical diagnosis. So it's the most common cancer in men, with 1 in 4 men in the black community and 1 in 8 men in the white community. So there are a lot of differences in terms of ethnic backgrounds in terms of prevalence of certain cancers, and this is one where particularly Black and Asian men are much more at risk of developing prostate cancer. So this prostate-specific antigens that I've mentioned, or PSA, you may or may not have heard of, but it's a very simple blood test that can be done. Takes a couple of days to get results from a lab back. And it's essentially a number that ranges from 0 right up to about 40. That's probably the highest one I've seen. And the higher the number, the more at risk you are of prostate cancer. So it's a very specific blood test. It's not like, some tests that we do where we're just looking at, inflammatory markers and we don't know where the problem is. We're very lucky to have a very specific blood test for prostate cancer. However, there's no national screening program for prostate cancer, much like there is for women with cervical cancer screening or breast cancer screening. So that's something that a lot of charities, particularly local charity that I'm quite affiliated with, which is called CHAPS, which is very good, that's run by a urologist that I used to work with called Chris Booth, really lobby for men to take control over their health, particularly with regards to their PSA readings. So to have an annual blood test, ideally from the age of 40, would be advised to check what your PSA is doing. The NHS won't screen prostate cancer for anyone until they get to the age of 50. And I've probably diagnosed about 30 men in my kind of fairly short career with prostate cancer before they've actually even reached that age or the threshold which the NHS refers to secondary care on, which is 4.5 for a man over 50. So prostate specific antigen reading of 4.5 would be where we would do a referral. Privately, I refer a man over 50 for anything over 3, and that's saved countless lives over the years. One patient of which that I saw this morning who's always eternally grateful for that, but it's just important to understand and know what these numbers mean, so that when you do have a blood test done, that you're empowered to know what that means and whether you need to see a urologist, which is the specialist that you would go under then for treatment. And the treatment for prostate cancer for an early diagnosis is very simple. It can be as simple as radiotherapy. It can be as simple as an injection of what's called brachytherapy, which is essentially almost like little iron filings that get injected, and then you go home and carry on your day-to-day life. Sorry, I just saw a question pop up on the chat and I lost my train of thought. Then there are a lot of other treatment options available as well that can be done, from operations, very simple operations, and then at later stages they can do whole prostate removal, which obviously isn't ideal, but better than cancer spreading. And that is really beneficial because obviously then you're not getting a spread of cancer essentially around the body. So those numbers are super important for that. So I'm just going to look at that chat that just popped up and said around about PSAs being increased for other reasons. So there are some reasons why PSA would be increased otherwise, like sometimes we see if a man has had trauma to that particular area, or even cyclists, for instance, where they have a saddle kind of sitting in that area. But it is very specific for prostate cancer, so it is a specific blood test for that. And you might need to get a second reading, but it's always what we will refer on. If a scan then shows that it's an enlarged prostate, which was one of the other main benign reasons for an elevated PSA, then at least you know from a scan. But in terms of a referral pathway, it's very specific in terms of referring. By the time we get to the NHS threshold for referring, which is 4.5 for PSA, about 25% of those men will have prostate cancer, which is significantly too high in my opinion. And the rest will have an enlarged prostate or will have had some sort of trauma to the area that's caused an elevation in reading. So it doesn't necessarily mean that just because you've got high reading that it is cancer, but it certainly means that you need to have a scan to discern what's going on. So one of the scary things about prostate cancer is that it often causes no signs or symptoms in its early stages. I've diagnosed men with stage 3 prostate cancer that have had no symptoms whatsoever. But in the later stages, and some men in the earlier stages, what they'll notice is that they'll have trouble urinating. They might have a decreased force in the stream of urine. They might have start-stop urination, so where it's quite intermittent. They might notice that they've got blood in their urine or even in their semen. And in much later stages, because of the spread of the cancer around the body, you would get bone pain and weight loss associated with the spread. So as a rule, we normally say if you're waking up more than once in the night as a man to go to the toilet, then you need to be screened for PSA if you're over 40. And a lot of men will say, oh yeah, I'm up a few times in the night, but it's just age, weak bladder. And it's just like, no, that's a red flag. We need to investigate why that is. And often it is just a weak bladder or is an enlarged prostate. But these are all early warning signs that something is changing that needs to be investigated. So please keep a lookout for those signs in yourself or in your partner or in your male friends, whatever it might be, in terms of that. My dad had prostate cancer probably about 15 years ago. And one of the things that I noticed, he's always been quite a loud weir, and there was a downstairs toilet in their house. And one of the things I noticed was I could literally hear this stop urination. And I said to him, Dad, that's not normal. You need to have a test. And that was obviously what prompted him to get a test and an early diagnosis. So just knowing, because of my background, I obviously know that's a risk factor. But if you don't know that, you'll just think, oh, it's age. So it's really good to be aware of these signs and symptoms and what they can mean. There's no concrete lifestyle changes that will reduce your risk of prostate cancer, unfortunately, apart from evidence has showed that regular exercise helps reduce your risk. However, it's worth noting that just that simple annual blood test by the time you're over 40 is the kind of best way of monitoring what your PSA levels are doing, as they do creep up with age. At least you can see what they're doing, and if they do get to a threshold for referral, you can get an early referral and early treatment as soon as possible. So I'm going to kind of put it out to the audience and to the men in the room, or even to the women in the room, with regards to their partners or men that they might know. If they or you are over the age of 40, do you have a regular PSA blood test? And by regular, I mean once a year or once every 3 years. If anyone's confident enough to talk about that, or even the converse of that. If not, what is the reason why you don't do that? Is it awareness, or is there a particular barrier or concern that's stopping you from doing that? Yes, someone's just said about the Chris Hoy programme last night. Yeah, I didn't actually see that myself, but I'm glad that people watched it and that. So in terms of, there's a question about how we get a blood test when there's no national screening programme from doctors. You can request it via your GP. That doesn't necessarily mean that they'll do it for you, but you can request it and say, look, you're worried about your PSA levels and you'd like to have a test, and they may or may not do it for you. If they don't do it for you, then there are many private providers like ourselves that will be happy to help and get you a reading for that. So it's just coming in to a clinic, or sometimes there's even online kits that you can buy if you can get enough blood from yourself for the kit to be successful and to get a reading. Then that's a possibility as well. So there are ways of doing it, but first and foremost, it's always good to try your GP if you can. But if you have no luck there, or just want for ease to go privately, then there's there. So there's been some chat around that people didn't know that they could get a reading for prostate cancer. So that's good that you're enlightened on that now. And people that have asked how they get a blood test if they're not getting it from their doctors, which I've just explained. And a few there, and people saying that they didn't know anything about it at all at the age of 56. So yeah, this is why it's so important to have this kind of health education that's there. So thank you for putting that in there. And someone said that you get it through an annual health check at work, which is great. So that's really good that employers are offering that for their staff. So thank you for that. So that's kind of prostate cancer in a nutshell. Excuse the pun, because the prostate gland is a bit of a walnut-shaped gland. If you ever get the pleasure of feeling one, that's what it feels like. And what we find when we do rectal examinations is that often you can feel literally like it feels like almost a hazelnut stuck to a walnut. It is much like a lot of cancers, like a lump that's attached to it. And it's for that reason that it causes those symptoms, like it pushes on the urethra, and that's why it impacts the urine stream, and it can cause a difference in kind of bladder ability because you feel the need to go to the toilet a bit more because you've got pressure there because of a tumour that wasn't previously there. So that sort of explains the physiology behind why you would get the symptoms. Okay, so we're going to move on to testicular cancer, which is next. So testicular cancer isn't as common as prostate cancer. So it's about the 17th most common cancer in men, so it's not particularly common. But the reason why I wanted to kind of bring it to your attention today is it's very easy. It's one of the easiest cancers to treat if it's caught early. And that's why the diagram that I've used in here is a little kind of guidance sheet around how you would check your testicles. So the advice is to check them at least once a month. The advice is to perform that test in the shower or bath, just because there's, you know, kind of more water to kind of help protect those delicate areas. They suggest using kind of soap to help so that it's not as sore when you're kind of pushing on the testicle to ascertain whether or not there are any lumps and bumps. And to check one testicle at a time. So it doesn't matter which you start with, but start with one, and to gently roll it between your fingers. So imagine it is just like a little kind of ball, and you're rolling it under your fingers to see if there's any asymmetry, to see if there's any lumps and bumps on what should be a very kind of spherical structure. What you'll feel towards the back of them is what are called spermatic cords. So they're kind of bits of tissue that connect the testicles to the scrotum to hold them in place. So those cords are normal, but often what we find in prostate cancer is that little lumps and bumps will appear on those cords. So it's important to check those cords rather than just the testicle itself, because often that is where the lumps present. So do make sure to prevent for the back. And what you're looking for is a very kind of hard lump. It's almost like a pea, very kind of hard pea, and it's often quite immovable. So it doesn't kind of move from the testicle. It's not like if it was a little cyst under the skin or something like that that would move. It kind of stuck onto the testicle, essentially. And much like breast screening in women, it's important to know, much like we say, know your breasts. It's important to know your testicles, know what size they normally are, know what shape they are, know if there's any differences that are just normal for you. And then also see if there's any pain that's associated with checking your testicles, because pain sort of signifies that there might be an abnormality. Some men don't get any pain, so it's not, you know, the only factor to consider, but it is important to note whether there's any pain that's caused when you're checking them and to get that checked out. So what I often advise men and women for self-checks is, you know, when it gets to the first day of the month, use that as a guidance. There's normally someone that would say to you, oh, it's November, or oh, it's, you know, December. That's kind of your reminder to do a bit of a self-check, and that kind of helps to make sure that you do it monthly to see what's going on. So 1 in every 250 men will develop testicular cancer. So it's not, you know, hugely common, but it is, you know, when you think about how many men there are quite a lot of cases, and we probably all know someone that's had testicular cancer. And again, there's quite a lot of treatments in place that can be done before the obvious, which is a removal of one of the testicles. So it's actually most common in men between the ages of 20 and 34. So it's a very young developing cancer, which is unusual because normally we don't see cancers very often in anybody under the age of 50. But this is one that's kind of quite exceptional for that, because it's not due to sort of radiation or length of life in the body, because you have cells that rapidly turn over quite quickly, and because the testicles are positioned outside of the body to keep sperm cool so that it doesn't become ineffective, that carries its own risk factors in terms of those cells changing and developing into a cancer. So that's why it's important to check, particularly for those young age groups, but also to remember that it is still important to test as you get older and outside of those age groups. We do still diagnose it in older men, but often I've seen a lot of cases in men, particularly in their 30s. So that's what we're looking for, and that's a bit of kind of information around testicular cancer that I hope that you'll find helpful and that will encourage you to self-check or get your partner or friends to check, so that we can hopefully save some lives from health education. Okay, so moving on. Does anybody want to tell us, share, you don't have to, but if anyone wants to, communicate whether or not they do a monthly check of their testicles, and if so, do they find it useful, or have they ever found anything, or if not, any kind of barriers or concerns to that? And again, you can use the chat as well if that's helpful. So the good thing about this one, because Debbie said in the chat that her husband's got a fear of needles, so won't go for blood tests. But the good thing about this one is that you can obviously self-check, self-screen, so you don't need to have a blood test for this one to confirm it. Obviously you do for prostate cancer screening, but for this one you don't, so that's good. Let's see. So yeah, someone said that they haven't really done it previously, but they will start now. So that's good. That's great news. And yeah, people are very happy to check themselves in the shower. So that's great. Well done, guys. That's good. So we're going to move on to our next topic now that we're covering, which is heart disease. So for heart disease, it's a massive killer globally, but also in the UK. It is more prevalent in men than women. There are a lot of risk factors associated with heart disease. So they include things like high blood pressure, high cholesterol, tobacco use, which includes vaping as well. Type 2 diabetes, because it makes the sugar in the blood, essentially makes it thicker and much more likely to form blood clots, which contribute to heart disease problems and deaths. A family history of heart disease, so we do see a lot of cardiac issues run in families. Obviously, a lack of physical exercise. So our heart is a muscle that needs to be used. If we don't exercise it, it does become a bit kind of sloppy, its functionality, and a bit inefficient. So it's important to do regular physical activity. The government guidelines for about 150 minutes of exercise a week is a kind of deemed a moderate good amount in terms of prevention of heart disease for men. Having excess weight or obviously obesity is a big risk factor for your heart. You're basically carrying around a lot more weight. Your heart is under much more pressure to circulate blood around essentially a bigger body, and that puts pressure on the heart muscle essentially. And often what we see is hypertrophy or increasing size of the heart tissue, that then the heart becomes quite inefficient because it's almost too large for its ability to kind of pump blood, and it becomes quite sort of floppy and inefficient. And that affects what we call the ejection fraction from the heart, which is the blood pumped out the ventricles. And that has big risk factors in terms of the signs and symptoms of heart disease, which include things like shortness of breath because you're not getting enough blood pumped out of the heart, or because there's a blood clot somewhere because the blood's quite viscous, because of dehydration or diabetes or other medical conditions. We often see, particularly where I look at many blood tests every day, a lot of people do have high cholesterol and a lot of people do have high blood pressure. And both of those can be managed very easily, but if you don't know about them, they are silent killers. Quite routinely, I'll measure someone's blood pressure and it will be above 160 on the systolic, the top number, which is quite significant force that the blood and the blood vessels are under. So it's important, even if you've not got any signs and symptoms of high blood pressure like dizziness or a red face or headaches, to check what your blood pressure is. And also to have a cholesterol check. You can have a cholesterol check from a finger prick test, so it doesn't have to be a full-on blood test, and they do it for free in places like Lloyd's Pharmacy and things like that, so that's worth knowing. And obviously, if you are a smoker or a heavy drinker or someone that eats a lot of kind of salt or sugary or fatty foods, to try to reduce those is really important in terms of reducing your risk of heart disease. So often what we find is people won't take up this advice until they have a cardiac event. So the number of people that I see in clinic that I'll say, you know, we need to get your cholesterol down a bit, or you need to do this. And then it won't be until something happens, like they get chest pain or heaven forbid they have a heart attack, that then suddenly they adhere to all this advice. So make sure that you're not sort of put into a situation where you're scared into changing your lifestyle. This should all be something, none of us are immune from any of this stuff happening to us. So making sure that we take the right kind of advice in terms of the right amount of exercise and the right kind of diet and reducing our risk factors is all really important. So there's a lot of particular things that increase your risk of heart disease, most of which we can manage. Even if there's a family history, there's a lot that can be done in terms of improving your own cardiac markers. And if you do, of course, notice any signs and symptoms of heart disease, which are things like shortness of breath or dizziness or palpitations, although there are other causes of palpitations, or chest pain like angina, getting that early diagnosis is so much better to have treatment than it is to obviously just ignore it and wait for something horrible to happen to you. So, you know, this does happen. We see it a lot. It's not really talked about in our society, but it really is, you know, a massive problem for particularly men. But it's worth knowing as well for the women that are listening, women are much more likely to get silent heart attacks than men. So one of the risks that comes with being a female is we don't necessarily get the chest pain that men typically get. You don't get that kind of crushing chest pain. Often women and diabetics don't get any pain whatsoever. So you have to really be mindful of the other symptoms, the shortness of breath, the hypoxia, the kind of cyanosis, which is when your lips and things start to go blue, maybe tingling down your arm. It doesn't have to be your left arm, it could be your right arm. So it's important to know those signs and symptoms as well, which is just worth saying. Okay, so we're going to move on from heart disease now. I'm going to talk about in general some of these preventative measures. So although I've kind of talked about them in each topic in isolation, I'm going to talk now around generally speaking what's important. So we talked about obviously the importance of a testicle examination and breast examinations as well. So that's not just women. So 1 in 10 cases of breast cancer are actually male breast cancer. So it is really important for men also, maybe not monthly, but certainly quarterly, to check your breasts or pecs, pecs areas, to see if there's any lumps and bumps, and making sure that you extend that right into the armpit as well, because that's often where lumps and bumps occur, more in the armpit than actually on the main kind of breast tissue. Being mindful of weight changes. So it's a real kind of big giveaway when there's something sinister going on in the body if someone loses a dramatic amount of weight quite quickly. So weight loss without trying to lose weight is key to notice in terms of a warning sign. And knowing your numbers, have a rough idea on what your waist measurement is, have a rough idea on what your blood pressure is, have a kind of rough idea on how much you weigh, because then you'll notice changes from that and deviations that will much quicker allow you to relay that to a healthcare professional who can then help and look into that and get an early diagnosis. So coupled with that, we know that some of the risk factors for these conditions that we've discussed, but also generally for health, are that if we improve our exercise level, if we reduce the amount of kind of junk food that we eat and processed foods, processed meats, and reduce our alcohol, then that's all going to have a positive effect on our overall health. Smoking, as we know, is a massive risk factor for most health conditions, and that includes vaping. A lot more evidence coming out about that now in terms of that being much more dangerous for the heart in particular than what was first thought. We thought it was more promoting respiratory conditions, There's much more people developing heart conditions off the back of vaping now. Essentially kind of breathing in carcinogenic chemicals is going to have a bad effect on you. So let's not kind of kid ourselves that it's better than smoking. And also one thing that we forget is obviously protecting ourselves from the sun and other sources of radiation. So we're all, most of us anyway, like the sun, and obviously that is radiation, which does cause changes in cells, which can obviously lead to cancers in particular. So it's just general good kind of preventative health advice there from a general health perspective. Okay, so moving on from the preventative measures, please. We're going to kind of move on to that kind of stress area that I mentioned at the start, and particularly focusing on what's called the andropause, colloquially. So often men get a bit left out from all the menopause chat that goes around, but there is very much, and I see this a lot, there is very much what's called an andropause, which particularly around the age of 50, I would say, although theoretically anywhere between the age of 40 to 60. But I do find a lot, whether it's psychological or whether it's physiological, that there's a big change at age 50 in terms of men suddenly having a little bit of a kind of mental health crisis or a midlife crisis, that often we kind of attribute to, turning 50, or it's a big life milestone. But when we look at blood results for people, often what we find is a massive drop in testosterone levels. And that shouldn't be underestimated, how effective these hormones are in regards to our mental health. So particularly also for men, for women as well, in menopause, obviously we know that can cause mental health conditions, but in men, testosterone plays a massive role in motivation, mood, sleep quality, and all the things that play into mental health. So I'd say that if you're a man or a man that's within that age group, particularly around the age of 50, and you're suddenly noticing that you're suffering with signs of anxiety or depression, or real kind of feeling kind of the pressure of life, I would say it's really important to have a testosterone blood test and also a vitamin D blood test. So what a lot of people don't realise is that vitamin D basically hugely increases your testosterone levels in both male and females, but more so in males because it's the predominant hormone. So increasing those levels of vitamin D will in turn improve your testosterone levels, which will in turn improve your mental health. And that's really important, particularly as we're obviously in winter now and we're not getting as much vitamin D from the sun. We should all be supplementing it all year round in the UK. And that can just sometimes be enough to offset the kind of andropause effects and the depression that can occur in men in that age group because of a reduction in testosterone. So it's really important for us not to forget the important role that plays and how quickly it can drop. So I often see, young men, let's say in their 20s and 30s, and their testosterone levels are about 20. And then I often see men in their 50s with testosterone levels lower than 5. So you can sort of, without really even sort of having a good grasp on that, know that that's a massive reduction, and a 75% reduction in a hormone that crosses the blood-brain barrier, that's very powerful in affecting mood and sleep and your life, is going to have a huge impact on you, just from kind of knowing that massive decrease is there. So I think it's just really important for us to be aware of that and to be aware of testosterone and the power that it can have over men in particular, but also over women as well. So it's just worth knowing, because we are really seeing what I call an epidemic of low testosterone at the moment. And we can't actually prescribe testosterone to men. We can for women, but for men we can't. It always has to be initiated by a urologist. And so for that reason, it's not a test that's very often tested by a GP. But the number of men that I've seen that I've tested testosterone for, and it's been so low, and then as soon as we've got a urologist to start treatment, within days they've been like a new person, has without doubt saved lives from mental health crises for those men. So it's just really important to be aware of. So I wanted to include that today. So then connected to that, moving on to the next slide.
Sorry, Sue, before you move on, just to chat, a question that's come through the chat is that somebody's asked, can these two tests, so vitamin D and testosterone, can they be requested at the GP? Or are you advising they get requested at like a private clinic like yourselves?
They can be tested at the GP, yeah. What we're kind of facing at the moment, because of the budget cuts within the NHS, is often a bit of a pushback from clinicians to say, oh, I'm not going to test that, you haven't got any symptoms of it, or you've got no family history of prostate cancer, I'm not going to test that, or whatever. Because essentially it saves money on doing blood tests. So I'd say always start with your GP, and some GPs are fantastic and don't have their hands tied financially, but a lot do. So I'd say if you can't get it onto the NHS, then don't sort of just accept that. If you know your body and something's not right, these tests aren't expensive privately, so it's just worth bearing that in mind and doing that if you can't. But yeah, first and foremost, GP is always a good place to start. So linking obviously with the kind of andropause, I wanted to include a bit on stress because of the younger men that are going to be in attendance today or listening to this in due course, is around how a man's stress response is different to a woman's stress response. So men and women process stress very differently, largely because of our different hormones. We know that women sometimes get more emotional with stress, and men often compartmentalize stress. So it's very frustrating for men and women when they're going through stress at times, because women will often say, oh, you don't seem affected or something like that, because men are very good at compartmentalizing and not thinking about something. And whereas it can be very overtly emotional for women. And for that reason, women are much better, generally speaking, at communicating with their friends, their colleagues, if something's not right. Whereas men, because they are good at compartmentalizing things, often you'll be totally oblivious that a man is under pressure or feeling stressed until they reach out or until something happens. So it's really important to understand that that is a physiological difference because of our hormones. And it also means that men can sometimes react more aggressively to stressful situations than women as well, because of mainly because they have higher levels of testosterone, which is a steroid hormone, which make more likely to make you aggressive. But in both sexes, stress can cause a feeling of constant fatigue. It can cause significant sleep problems. It can cause irritable bowel syndrome, hormone imbalances, headaches, migraines, joint aches and pains, burnout. And so it's really important. I know a lot of you will have seen this diagram before, and it's very simplistic, but it's very helpful just to think on a simplistic level, what are the stresses going into your stress bucket, into your life, and what are your outlets? And it's very easy to kind of think about, and makes you realise at times that actually you've got all these stressors going in, and actually you haven't actually got any coping mechanisms for that. Like you've stopped meeting up with your friends for a coffee or a meal, or you've stopped that exercise class because you don't have time for it, or you got a dog walker because you haven't got time to walk the dog, or whatever. And suddenly all those things that allowed you to cope and allowed you to process everything in life aren't there. And that's when obviously the stress bucket can combust. And no one wants that, because it's not good in terms of obviously feelings of anxiety, feelings of depression, and broader mental health conditions that can occur as a result of that. And so I just wanted to kind of mention that today, to just think what you've got going into your stress bucket, what are your outlets, and if you haven't got enough outlets as you have stresses going in, make sure you make time, some me time, for those things that you will find relaxing and enjoyable for your own mental health and sanity. Okay, so if we move on, I think that's the main kind of topics that I wanted to cover today. So just in summary, we've looked at why we're kind of focusing and honing in on men's health in particular, particularly because it's November as well, and that's been allocated as Men's Health Month. So really important for us to have be mindful of men's health conditions, and those that are unique to men, as well as those that are not unique to men and apply to both genders. but looking out particularly for the male cancers, for the factors that affect the health of our hearts, to look out for those kind of mental health risks that, you know, very prevalent in society in our busy lives. And because men are very affected by these things, to really encourage the men in our lives to seek and try to balance out that statistic of, you know, half as many men seeing a GP as a women. You know, that really needs to increase, and will have massive repercussions and benefits if men do earlier seek advice on health problems. We looked at some of the UK statistics and how as many as 1 in 4 men can develop prostate cancer, how that's more prevalent in Black and Asian men, and obviously more prevalent once you get over the age of 40, and the risk increases with age. We looked at kind of cancers and smoking and other risk factors in general, as well as talking about testicular cancer. And then lastly, we talked about the andropause and the importance of testosterone in terms of male mental health and why that's important, and then a little bit about how we can manage that stress and also help men to focus and be mindful and make me time so that they're better able to cope with the stresses in their lives. So I hope you found the talk useful. Try to cover quite a broad range of topics affecting men's health in particular. Please do put on the chat or ask any questions if you've got any questions. And alternatively, you can get in touch with me. My email address is on the screen now, just by the dog's ear, which is good positioning. We are on Instagram as Wellbeing Clinic Essex and Facebook as Wellbeing Clinic, and you can always phone our clinic, which is in Colchester, or look at our website if you're interested in any tests. Yeah, do let me know if I can help you basically with anything to do with your health. So any questions from anyone?
You can unmute yourselves now if you want to just ask the question out loud if you feel courageous enough, or you can pop it into the chat if you're still feeling a little shy.
One question we just had come through saying, will they get a copy of the slides after the webinar today? And
the recording will be made available after today's event. Yeah, as usual, it will be uploaded through our YouTube channel onto our Kingswood Group webpage.
Wonderful. And as you've missed the first of the month, let's start today. Those men in the room, you know, make today the first day that you start doing those self-checks, and then get the reminder in your diaries for the 1st of December. Yeah, so if there's no questions, I mean, I'll stay, you know, if people feel more comfortable once people have left, then that's great. But yeah, free to go. I hope you've learned something. I hope you've enjoyed something. I hope it has good effects in terms of your own or your family's health. Gemma's also just put on about get in touch with inquiries at kingswoodgroup.org as well. That's a good way of getting in touch for anything that Kingswood Group can do from sort of an HR perspective and things to help your organisations with this kind of stuff as well.
Yeah. Thank you, Sue. Thank you so much. Thank you. Yet again, I always feel so enlightened by your talks, and I end up thinking, right, I must remember to pass this information on to people. And I especially enjoyed the andropause talk with the man with the little ankle socks on at the end. You know, I thought that was I was having visions of men in you know, off the shoulder all the way down to ankle socks. So I particularly enjoyed that. Thank you. But in all seriousness, you know, there are some serious subjects in here, but delivered in such a accessible way, thanks to you. So I'm sure everybody today has learned something that they didn't know before and can take away and start putting things into action now, or certainly passing that information on to the men in their lives. As Sue said, you can contact Sue at the Wellbeing Clinic Essex direct, or if you haven't got those details to hand at the moment, we'll be sending all the information out after today's webinar. And you can also get in touch with Kingswood Group. So if you are
Wonderful. Thanks so much for having me.
You're welcome. If there are no other questions, we will close today's webinar, and thank everybody for coming. If you could just remember to exit the webinar, that would be really great. And if the Kingswood team and Sue could just stay on the line, that would be fantastic. But for now, have a lovely rest of the day, and don't forget to diarise the 1st of every month, guys.
Thanks, everyone.
Thank you.